Hi everyone, welcome back. So in this video I'm going to be talking about something called adhesive capsulitis, which most people will know as frozen shoulder. So frozen shoulder is basically where the shoulder joint will gradually become painful, will gradually become very stiff for no apparent reason. And this pain and stiffness will get worse and worse until you pretty much have no movement in that shoulder at all. And if left, it will finally disappear. But this can usually take between 1 and 3 years. So this is quite a long-term issue. But hopefully I'm going to sort of talk about things that you can do, and obviously sort of suggested sort of causes and risk factors, things that you can look out for, to hopefully kind of ease the shoulder up before you get too much of a problem. Now, usually with this, only one shoulder is affected, and the loss of your range of motion, it may be partial or it may be complete, as I say, locking down the whole shoulder blade, and just meaning that you can't really sort of do any movements with the shoulder at all. If untreated, as I say, it will go away usually sort of after 1 to 3 years, but if untreated, it will almost certainly get worse, a lot worse before it gets better. Now, the shoulder is a ball and socket joint, and the surrounding tissue of where the socket is called the shoulder capsule. Now, the ball and socket joint, it allows forwards, backwards, rotational movements, extension movements, and it's a synovial joint. So you've got that synovial fluid there within the capsule, which just lubricates, protects the joint and helps to maintain that fluid movement that, we all have when our shoulder is healthy. Now, this shoulder capsule is a really busy area in terms of ligaments and tendons, the bursa, which are your fluid-filled sacs, all running through there. Plus you've got the rotator cuff muscles, which of course surround the shoulder blade. And so while, all of these structures help to, really maintain flexibility, the fact that it is such a busy area can also make the joint vulnerable to trauma. So basically what happens, so you can see the shoulder capsule here with the ball and the socket joint. Now when this protective capsule contracts and stiffens, the shoulder will then become frozen. And what happens is that you then get a load of scar tissue forming in that capsule, in the joint, and around sort of the head of the humerus, which is that upper arm bone, due to a lack of synovial fluid to lubricate the joint. So you get this build-up of scar tissue, and what that does is then further restrict movement inside the joint, resulting in pain and, really limiting the range of motion. Now, while not fully understood, the contraction of this capsule is most likely due to the inflammatory process, and possibly long-term immobility, maybe from injury or surgery or illness. Certainly if we look at stroke patients, they are very much prone to a frozen shoulder. Now obviously there's some neurological stuff going on there, but it's that immobility. If they have weakness on one side, they're going to be very much prone to, to having this problem. Or overuse injuries, so things like bursitis, tendinitis of the rotator cuff muscles are also likely to be a common factor. Quite often, we might sort of feel a bit of an ache, bit of discomfort, and then our own efforts to try and avoid painful movement can often lead to, further contraction of the shoulder capsule, which of course then makes, the range of motion and the build-up of scar tissue even worse. Now, as we've said, a frozen shoulder can get better by itself, but it can take up to 3 years for this to happen. And let's face it, if you've got no movement in your shoulder, you don't really want to be sitting around waiting for 3 years for it to get better. So treatment is certainly advised in order to improve the range of motion and ease pain. It's very uncommon to have frozen shoulder more than once in the same shoulder. Saying that, if you have had frozen shoulder once, there is a very good chance that you may get it in the other shoulder at some point. So that's certainly something, that you need to maybe be aware of. Now, there are also other diagnoses that, may get mistaken for frozen shoulder. So here we're looking at rotator cuff injury. So there's 4 muscles that sit around the shoulder blade. If you injure those, but that tends to only be painful with active movement, not with passive movements. Whereas with a frozen shoulder, both active and passive movements are going to be painful. So that's what's going to sort of tell you the difference. Other things, maybe things like osteoarthritis of the shoulder, tendinitis of the biceps tendon, and that biceps tendon from the arm muscles runs right across the top of that shoulder capsule. And I'll be talking more about that when I do the post on slap tears. Also inflammation of the bursa. So we've got a lot of these sort of little fluid sacs around the shoulder joint, which help just cushion the joint. And you've got bursa just under the collarbone, around, and around the shoulder. So this is known as subacromial bursitis. And again, that can often have sort of similar symptoms. Also rheumatoid arthritis of the shoulder as well. Now, in terms of risk factors, how do you know if you're going to be at risk of developing this? So it will affect probably around 3% of adults at some stage in their life. And it certainly seems to be more common in women than men, between the ages of 40 and 60. Now, possibly this is maybe due to some sort of hormonal influence, but nothing's been sort of, definitively proven. Most commonly, it will affect the non-dominant shoulder, with 1 in 5 cases also developing in the other shoulder at some stage. Quite often it may develop following, if you've had some sort of shoulder injury. 10% of people with rotator cuff disorders usually go on and develop a frozen shoulder. Lack of exercise after an injury or something like tendinitis, or even wearing a sling. Sometimes you have an arm or shoulder injury and you think you're doing the right thing by wearing a sling. But if you do that without intermittent stretching, then you're going to start to really weaken those muscles and your range of movement is going to be limited and you're going to be more prone to a frozen shoulder. Also, we mentioned in the beginning about stroke patients, certainly recovering from a medical condition that prevents movement of the arm. So, as we said, things like a stroke. Also, in women, things like a mastectomy, if they've been a breast cancer patient, that can also, limit, movement on one side. Certain medical conditions, so things like heart disease, thyroid disease, Parkinson's, and also between 10 and 20% of people with diabetes are also prone to having a frozen shoulder. Now, if we take into account the fact that, women, it affects women more commonly. We've talked there about diabetes and also thyroid disease. I'm going to go on and I'm going to talk a little bit, a bit further on in this video about a theory that talks about hormonal influence, and certainly those issues have that hormonal factor. If we look at causes, there's not been, as I say, there's not been a definitive cause identified, but certainly things have been linked. As we've just said, stroke research shows that 72% of stroke patients experience a frozen shoulder, really due to that period of immobility. Broken arm, as we said, wearing a sling, if you're not doing intermittent stretching, then, following a broken arm, treatment and recovery can take months, and trauma that is enough to break bones, it can cause that protective tissue around the shoulder to thicken. And again, you're going to get build-up of scar tissue, which is really going to limit your range of motion. We mentioned about rotator cuff injury. The rotator cuff muscles help to connect the arm with the shoulder and basically stabilize that shoulder joint, but it is prone to injury due to the fact that it is exposed to high impacts. And obviously, if you're doing like contact sports, that again is going to, increase the impact on the joint. Other suggested causes are recovery from surgery. Again, if you've got a period of immobility, build-up of scar tissue, that again is going to reduce your range of motion and increase pain levels. Diabetes, we mentioned. Diabetes can affect the skeleton in various ways, and for some reason the shoulder joints are often targeted. Heart disease is really due to disruption of blood flow, and therefore disruption of nutrients and oxygen around the body, which obviously helps to maintain all the proper functioning of all the body systems and also the joints. Underactive thyroid. Now, the thyroid releases hormones, thyroxine, that affects the metabolism, and any imbalance of these hormones can result in various symptoms, which anyone with an underactive thyroid in particular will know, includes weight gain, fatigue, weakness, and stiffness. An overactive thyroid, where you're releasing too many hormones, will cause anxiety, rapid heartbeat, and also affects the joints and muscles. Parkinson's disease, we also mentioned as a risk factor. Now, this is a neurodegenerative disorder, can cause loss of mobility again, tremors, difficulty balancing. So again, that loss of mobility, can be a factor. And also tuberculosis as well has been suggested. Mostly it affects the lungs, but it can infect other parts of the body, causing fatigue. Now, we talked a little bit about the hormone factor. Now, there's a theory. It's Dr. Austin Ullo's perfect storm theory about frozen shoulders. Now, this theory suggests that there is a perfect storm of 3 issues that occur simultaneously, causing a frozen shoulder. And this certainly has been apparent in some of my clients, whether they're aware of it or not. So the first of these 3 issues is that there has been some kind of lower neck disc pathology or nerve compression. X-rays on patients with frozen shoulders almost always occur alongside lower neck disc conditions. One of the most common being degenerative changes at C5, C6, which is at the bottom of the neck. And again, talking about degenerative changes, we talked earlier on about arthritis, being one of the risk factors. But also it can be muscle conditions which compress the nerves in the lower neck, that supply the shoulder and the arm with motor and sensory information. The second factor, as we talked about briefly, is hormonal imbalance. So frozen shoulder almost always occurs alongside some sort of hormonal imbalance, whether this is menopause, diabetes, thyroid problems, adrenal stress, in men, testosterone imbalance, or even chronic stress, which of course impairs adrenal function and increases those cortisol levels. Hormonal imbalances, again, such as the menopause, a lot of people don't realise that can cause increased scar tissue formation, meaning that even just a minor injury of that shoulder muscle may not heal quite so well. And this is due to an uncontrolled immune healing response. And of course, our hormone levels, the hormonal system can help also regulate the immune system. The third issue is that, so we've got some sort of neck disc pathology or nerve compression. We've got the hormonal factor. And the third one is that there will have been some sort of shoulder strain injury. People who get frozen shoulder will often just wake up one day with a stiff and painful shoulder, which can often be related back to a strained muscle maybe a few days before. Maybe they lifted something awkwardly, or maybe they're sleeping in an odd position, and certainly side sleepers quite often is a factor in a lot of my clients. And what that does is, just even if it's a minor strain, it initiates the inflammatory response in the body. And of course, if your hormonal system is all over the place and that's having a knock-on effect on your immune system, then, the whole healing response, when you get inflammation, that's not going to be as efficient as it should be. And so problems, therefore, are going to, arise. So the theory is that the nerves in the lower neck are compressed by an issue with the cervical discs or the neck muscles. And this causes motor signal transmission problems into the shoulder. This causes weakness in the shoulder muscles. And if severe, symptoms such as neck or shoulder pain, headaches, numbness in the hands will be present. But otherwise, it is possible that compressed nerves will go unnoticed. Now, if a muscle injury is involved, the inflammatory response kicks in to promote healing, overseen by the immune system, which is linked, as we've said, to the hormonal system. Inflammation will peak at 3 to 4 days after injury, which explains why people suddenly wake up feeling stiff. Now, normally, contraction of the shoulder muscles against a resistive load may then stress the muscle, causing a tear in the muscle tendon, or shoulder capsule. Swelling generally protects the area from injury and promotes the hormone secretion to allow healing. Stronger tissues will then rebond the torn tissue, which forms scar tissue and adhesions. Now, with frozen shoulder, the inflammatory response is much, much stronger due to a hormonal imbalance, which also causes, as we've said, an imbalance in the immune system. So the healing response will then be over-exaggerated, forming excessive scar tissue across that shoulder capsule. Then we're going to start to see, obviously, all of the symptoms. So I'm going to talk a little bit about those now. Now, the symptoms, as we said, it will only be experienced in one shoulder. Usually only one is affected at a given time. Everyday activities, so things like driving, dressing, sleeping, can all become difficult. And if left untreated, symptoms, as we've said, may last 2 to 3 years before disappearing. So the main symptoms that are exhibited with frozen shoulder are a dull, aching pain in one shoulder, possibly around the top of the arm. The pain may get worse at night, which can cause sleeping problems. And there's also going to be increasing amount of stiffness and loss, sometimes complete loss of mobility of that shoulder. Now, there are 3 stages of frozen shoulder. So the first stage is the freezing stage. So this usually lasts between 2 and 9 months. This is where pain is noted first and then limited movement. Symptoms will gradually worsen, particularly with movement or when lying on that shoulder at night. And so that's why I always say to my clients, if they sleep on their side, the best thing is to try and sleep on their back. But, if they sleep on their side, try and sleep on the other shoulder that's not injured. Then you have the frozen stage. So this usually will last between 4 and 12 months. And the pain will gradually ease, whereas the stiffness tends to worsen in this stage, which affects all shoulder movement, particularly external rotation of the arm. Now, at this point, the shoulder muscles may start to atrophy due to lack of use, which obviously again is going to kind of worsen the problem. So it's important to try to keep doing some sort of exercises, even though you will have the stiffness there. Just try and do what you can to keep that shoulder as active as possible, or to come along and have something like a deep tissue sports massage. And then the third stage is the thawing stage. So this is the recovery stage, which usually lasts between 1 and 3 years. So in this stage, the pain and stiffness will gradually disappear and normal range of motion will gradually, be restored. So if we look at treatment, how do you treat a frozen shoulder once you know that that's what you've got? So certain movements, are characteristic of a frozen shoulder. So as we've said, sort of external rotation of the arm, reaching across the chest to touch the opposite shoulder, or, down your back to touch the opposite shoulder blade. These are characteristic problems, in terms of mobility. There is a chance that your shoulder will get back to normal without treatment, but as we've said, this can take a couple of years. So most people like to find some kind of treatment option just to help ease symptoms as much as possible. So, treatment options. Obviously, when you've got pain, the use of anti-inflammatory painkillers, something like ibuprofen, diclofenac, naproxen, but these should really only be taken in the initial part of the freezing stage to reduce inflammation. And given the theory of hormonal influence, it's also important to be aware that these drugs can affect the kidneys. So if there is any kind of adrenal gland issue or diabetes, you're better off not taking these. Shoulder exercises, really important just to try and maintain what mobility you can. It will help to reduce any further stiffness, even if it doesn't appear to be kind of reducing the stiffness that's already kicked in. It will hopefully help to prevent it from getting worse and maintain as much movement as possible. Physiotherapy may advise on exercises and other pain relieving techniques. Things like warm and cold packs, TENS machines may be helpful. Also, some people opt for steroid injections, which can relieve symptoms for several weeks and reduce inflammation. However, these injections can damage the tendons inside the shoulder, introduce infection or cause bleeding. And of course, it's not sort of one injection and then you're done. You're going to probably need another one at some point. And it's not a long-term solution. You can only have so many. Now, also, given the perfect storm theory that we talked about, which also included chronic stress in the hormonal issues due to cortisol release, this may not be the best option to go and have a cortisone injection. And this is one place where, massage can really benefit, because as we know, massage can help reduce those stress hormones, which includes the cortisol. Now, hormonal treatment may be an option if you are aware of, or if you suspect that maybe you might have some kind of hormonal imbalance. Maybe if you think you might sort of be going through the menopause, maybe you might have thyroid issues. Or you suffer from any of those medical conditions such as diabetes, for example, it may just be wise to speak to your GP and get some blood tests done just to check the levels and ensure that any treatment for that issue is sufficient. Joint distension is another possible option, where you basically have an injection of sterile water into the shoulder capsule to stretch it in order to improve movement. And of course, the final option, which really should only be considered if other treatments don't help, possibly surgery is an option. But this can damage the shoulder elsewhere. And of course, as we know, any kind of surgery or trauma again is going to introduce more scar tissue, which of course is part of the problem in the first place. Now, apologies for the quality of this picture, but one of the surgical options may just be manipulation of the frozen shoulder, where the shoulder is mobilised under anaesthetic to release scar tissue. But of course, this does carry a risk of damaging other parts of the shoulder. So obviously, when you've got, that shoulder capsule is frozen with scar tissue, you can see all the scar tissue around here, and that inhibits the movement, which causes significant pain that may even radiate down the arm and past the elbow. Once the patient is under anaesthetic, manipulation will be performed. And then after manipulation, basically, this scar tissue that has been causing the problems with the range of motion around that shoulder capsule and causing the capsule to contract will be torn. But this in itself is going to create more, more scar tissue. So it does require that there's a lot of physical therapy following this to prevent new scar tissue from, reforming, which obviously would, cause the shoulder to be frozen again. Another surgical option, which is probably more common, is an arthroscopic capsular release. And so this is where the tight capsule in the shoulder is basically released with a probe. And that's all sort of done keyhole. Other treatments, things that you should be aware of: don't immobilize the shoulder. So using a sling in an attempt to support the shoulder will actually make recovery much, much harder and encourage further muscle weakness and further stiffness and loss of movement. Also, massage therapy, of course, will help to strengthen and stretch the tissues, encouraging mobility, and can also be used to help work on that scar tissue and breaking some of that down. Now, of course, there are certain exercises that you can do, which, you should probably always warm the shoulder up beforehand by either taking a warm shower or bath, or maybe just using a heat pack around the shoulder for 10 to 15 minutes before performing these exercises. And that will just help to prepare the muscles, so if the frozen shoulder is severe, the active range of motion, so that is the movement that you can perform yourself without any assistance, will be less than the passive range of motion, i.e. movements you could perform with the assistance of someone. So consequently, many exercises will use the healthy arm or a pole for assistance. When performing exercises, you want to be stretching to the point of tension, but not pain. Any activities requiring overhead reaching or lifting or that increase pain should be avoided. At least 90% of people improve with these exercises, but full recovery will take months to years. So I'm going to start by, talking about some really gentle exercises, to help. So probably the first exercise that you want to do when you're just starting out is the pendulum exercises. So this is where you stand and lean over slightly, shoulders relaxed, allowing the affected arm to hang down. And then you're just going to swing the arm in a small circle, about 1 foot in diameter. And you're going to just swing it 10 times in each direction. And then as your symptoms improve, you can increase the diameter of your swing. And then eventually you can do this holding a 3 to 5 pound weight. So then we have supine flexion. So you're going to lay down flat on your back with your arms at the side of the body. Then, using the healthy arm for assistance, you're going to lift the injured arm vertically in the air and backwards to the floor with the help of the healthy arm. And you're going to keep reaching until a stretch is felt, eventually lifting the injured arm overhead. Now, at first, you may only be able to go a little way, and that's fine. You just try to sort of increase it each time. The next one is a standing extension, which you'll need a pole for. So you're going to stand holding the pole horizontally behind the body, arms shoulder width apart and knuckles towards the ground. Then you're going to lift the arms in an upward movement until a stretch is felt, and then repeat 10 times, holding for 1 to 5 seconds. Then we have our cross-body stretch, where you can sit or stand with both arms relaxed at the sides. Bring the affected arm across the chest, supported by the healthy arm at the elbow. And then you're going to hold it for 15 to 20 seconds. And again, you may not be able to bring it right the way across to start with, so you just go as far as you can and then gradually, move a little further each time. So the next one is a passive doorway external rotation. So you're going to stand facing one side of the door frame. You're going to bend the affected arm to a 90-degree angle and grab the edge of the door frame with the hand of the affected arm. You're then going to rotate the body so the back side is now in the doorway. And you're going to hold for 30 seconds and then repeat. The next one is a towel stretch. So you're going to use a rolled up towel and you're going to hold it with both hands behind your back in a horizontal position. Then you're going to use the good arm to pull the affected arm up to stretch. So in this picture, this would be the affected arm, and this is the good arm that you're going to use to pull up. Then we have an armpit stretch. So you're going to stand and lift the affected arm onto a shelf, about sort of chest height. And then you're going to slowly bend your knees. And as you go down, you're going to slowly open up around the armpit area. You're then going to deepen your knee bend slightly, gently stretching the armpit, and then straighten. And with each knee bend, you can stretch a little bit further. Once the range of motion improves, you can move on to the following exercises to strengthen the rotator cuff. So all of these exercises that I've shown you so far are for that early stage. So, strengthening the rotator cuffs, the next stage of exercises. So you can start with this outward rotation. So you can hold a resistance band between your hands with your elbows at a 90-degree angle, close to your sides. Then you're going to rotate the lower part of the affected arm about 2 to 3 inches out to the side, sort of hinging at the elbow. And you're going to hold for 5 seconds. Now, alternatively, you can attach one end of the resistance band to a door handle on a closed door and do it that way. Then you're going to do your inward rotation. And so here, like we just said, you're going to attach the resistance band to a door handle, stand next to the closed door, and you're going to hold the other end with the affected side, holding the elbow again at a 90-degree angle, and then hinging at the elbow, you're going to pull the band towards the body 2 to 3 inches and hold for 5 seconds. Okay, so those are the exercises. So how does massage help with a frozen shoulder? Well, massage is often used by those with a frozen shoulder at some point, and it works by improving the blood circulation and therefore the nutrient and oxygen supply to all those, particularly the rotator cuff muscles and all around that shoulder capsule. This will assist with healing relaxing and improving the mobility of those stiff muscles around the shoulder, and also will assist with breaking down scar tissue around that shoulder capsule. Now, various techniques can be used to treat a frozen shoulder, and regular massage is necessary to keep on top of the symptoms. This is one of those times where it's not just a case of one massage is going to sort you out. It's not. So in terms of the types of massage, now Swedish massage can be used, but it's more relaxing strokes and kneading, which can help alleviate some tension within the surface muscle tissue, but it's not going to work deeper into those tissues. It will also help reduce levels of cortisol, which is that stress hormone. But I think, to really access the scar tissue around that shoulder capsule and all those soft tissues and really get into the tension in those muscles, you need something deeper. So we'd be looking at something like a deep tissue, or, more than likely a sports massage, where there is consistent pressure on the muscles. It can relax the scar tissue, which is what's causing you the pain, but this is best avoided if you are still in that inflammatory phase, because then it's going to cause more pain. Trigger point therapy can also be beneficial. Again, the steady pressure being applied to specific points on the muscles, can ease the muscle spasms and pain. And these are points usually between either two areas of severe tension or between those areas of scar tissue. And you can find my previous post on trigger points, which will explain more. Heat therapy, before or after the massage, rather like when you do the exercises, and I said about taking a warm shower or using a heat pack. Again, using a heat pack before and after the massage will just help relax those affected muscles, further relieving the tension and pain, and also really allowing the therapist to get into those muscles as deep as possible, during the treatment itself. So that's really all the information on frozen shoulders. Hopefully it's given you a few thoughts on what you can do. I think this tends to be one of those, problems where people often are just at a complete loss as to how to help it. As I have said though, this is a long process with a frozen shoulder, so it's not a case of you're gonna have a treatment and then miraculously it's all going to be better. This is going to take time and it needs regular treatment. So do persevere. And if nothing else, it will certainly help in preventing further injury and further scar tissue, which will make the problem worse. So any questions, feel free to message me. You can comment down below. You can contact me through my Facebook or Instagram pages, on there as the Medical Massage Lady. And feel free to subscribe to my channel. There will be more posts. There's already lots up there about medical issues, sports injuries and muscle groups and things. There will be more coming. I'm going to be doing 2 more posts on the shoulder, one on dislocation and one on slap tears, so do keep an eye out for those, or if you subscribe you'll be notified when they come out. But for now, that is really it from me. So I will see you next time. Bye.